what the business building equipment will be or supplies will be, but if you're going to have the number of units, there's certainly going to be couples with children. And to me, this is basically a density area with a lot of housing, and I wouldn't want people, kids not to have a place to be, and that worries me about the highway, but also the idea that there's just no amenities on this, that are indicated on the site plan. No amenities for the families that would live there, and I'm assuming that there would be people, because we've projected staffing, or school increasing, so seems like a lot. But we have two other council members. Is there anyone that has not spoken on the issue that would like to speak on the issue? If not, then we'll go back to Ms. Ajmira, who will be followed by Ms. Watlington.
Thank you, Madam Mayor. So my question around road trips was addressed by Councilmember Driggs. I guess this development would generate less trips than what would be under current zoning. So I think in a way it addresses traffic issue by reducing the number of trips that this development will allow, or this development will generate. And I don't have any more questions, Madam Mayor. Thank you.
All right, Ms. Watlington.
Yes, I just wanted to address a couple of those things. Oftentimes I hear this idea of the rezoning will produce less trips than the entitlement, but I think that neglects to consider that right now versus existing, it is significantly increasing the trips. And if somebody was wanting to build versus the entitlement, we wouldn't be having a rezoning. We understand that there are financial and market considerations that prevent people from building versus the entitlement. So I think it's a little bit short-sighted to go versus an entitlement when we know that nobody's building an attractive project versus the entitlement. So I think that we have to be careful about saying that, because what we're really comparing is the existing versus the development, because the entitlement right now is not an option. So I don't think that we can use that as a justification for increasing density in our rezoning. The next piece that I wanted to ask, and I'm glad, Dave, that you clarified the rezoning piece, because I do want to go back to that. As I understand what you're saying, is that in the event that someone comes back and wants to build there, they have to build versus the zoning plan. So I'd have two questions as follow-up. The first one is, does that include the traffic improvement?
Yes.
Okay, and the second question is, based on that traffic study that was done that justified that improvement, I don't believe that any potential increase in traffic versus based on rezoning was included in it, correct?
I'm not sure I understand your question.
What I mean is, when they made the assumptions for the traffic study that they did to justify adding a dedicated turn lane onto 160, they didn't do it with an understanding that there would be a rezoning here.
No, they did it with the underlying background traffic and any other, I guess, existing potential traffic that they would have. I don't know if it considered any potential rezonings in the area. It just would consider what was either constructed or in the pipeline as background traffic.
So that's concerning to me, because that tells me, so I'm concerned that there's a proposed street to nowhere here that traffic will have to either go left to 160 or right to South Tryon. We know some bit of that traffic is going to go left to 160 right now, because there's nothing really in the pipeline for 2019-30. That tells me that there's not going to be any traffic improvement there. But even when it comes, it's already going to be above capacity versus the original assumptions. So again, I would urge my colleagues, Still Creek ask for one thing. They do not ask for much. They sent us all here. Everybody that was on the ballot that Still Creek residents voted for, they want one thing: stop the bleeding and protect the traffic on 160. I would ask that we honor that one request. Thanks.
All right, are there any other speakers from the council? Any other questions for the staff or the speakers on the petition? Hearing none, do I have a motion to close? I have a motion to close
Moved.
and a second.
Second.
All right, Mayor Pro Tem,
Yes.
Ms. Ajmira,
Yes.
Mr. Mitchell,
Yes.
Mr. Eggleston,
Yes.
Mr. Graham.
Yes.
So that's, is there anyone in opposition to closing the public hearing? Hearing no one in opposition, the hearing is closed. The next item is item number 37, petition 2020-017 by Aspen Height Partners, approximately 2.75 acres located east of Baltimore. It's in District 3. The current zoning is 22 units of multifamily per acre residential, and the proposed zoning is mixed-use development conditional. Staff recommends approval. On this one, we have one speaker, Mr. Colin Brown is the speaker that's signed up. So we'll get Mr. Brown ready after the staff presentation.
Okay, thank you, Madam Mayor. 2020-17 is on Remount Road and Baltimore Ave and Norfolk Avenue. The request is for a rezoning from R22 MF to MUD CD. The proposal is part of the adopted future land use for the New Bern Transit Station Area Plan, which recommends institutional uses that is mainly based on the existing institutional use that's on that property in that general area and that has been there for some time. This petition is looking to redevelop the site for up to 274 multifamily residential units with a parking garage. Building height would be limited to 68 feet. A minimum of 1,000 square feet would be reserved for community space for local nonprofit organizations to be used as seen fit through coordination with the Bethlehem Center. It does have some transportation improvements associated with it, including one point of access on Baltimore, one point of access on the Norfolk, along with dedicated service drive with vehicular maneuvering for dumpster and compactor. Recycling area will be within that building. Extends the bike lane from the site's frontage to the intersection of Remount Road and South Tryon. Also constructs a pedestrian refuge island across Remount Road. ADA compliant bus waiting pad would be constructed on Remount Road, as well as 8-foot sidewalk and 8-foot planting strip, and an 8-foot amenity zone along Remount. 8-foot sidewalk and 8-foot planting strip would also be on Baltimore Avenue and Norfolk Avenue as well, and accommodate on-street parking on Norfolk Avenue, as well as some architectural standards. Staff does recommend approval of this petition. We do have some outstanding issues related to the environment, transportation, site and urban design, and one technical revision. It is inconsistent with that institutional recommendation. Again, that's from one of the long-term existing land uses that is on that property and then that area. Staff does feel that the petition is appropriate given the proximity to TOD uses and light rail along that corridor from Remount over down to South Boulevard. So we do feel that an increase is appropriate in this area. And we do recommend, like I said, approval upon resolution of some outstanding issues. And we'll be happy to answer questions following Mr. Brown's presentation.
All right, Mr. Brown?
Good evening, Madam Mayor. Colin Brown on behalf of the petitioner, and I've got hopefully a presentation. There we go. Again, Colin Brown on behalf of the petitioner, Aspen Heights. Hopefully this, maybe I'm not advancing, so next slide, please. There you go. Hopefully you'll recall earlier tonight you approved a rezoning for a property that was also owned by the Bethlehem Center. So we had two rezonings by different developers that are coming through together. One was by the Hopper Communities folks who are doing a townhome development next door in this area here, if you can see my screen. But the area where the star is the heart of the Bethlehem Center, as you can see here, which Aspen Heights intends to redevelop into a multifamily community. Dave did a very good job of that. One of the questions, the concerns, this is a rapidly changing area. That is one reason the Bethlehem Center, they're looking to move their mission to where their constituents are. One of the things that Ms. Watlington had asked early on in this process was, well, could there be community provision built in? And so the petitioner has actually worked with the Bethlehem Center to set aside a portion of the ground floor area so that they can maintain a community space. So we think that's a real victory for the area. This is showing you side by side. This was the Hopper petition just to the north and west that you approved earlier tonight. So a little bit of diversity of housing there, some for sale units. This is a concept of the Aspen Heights plan. I think Dave did a good job on the technicals, so happy to answer any questions you may have.
All right, thank you very much. So are there any questions for the petitioner?
Madam Mayor?
I'm sorry, Ms. Watlington, I didn't, I just realized that your hand was up. Was that Ms.
I raised it
Watlington?
late. Yeah, I
Yes,
raised it late. No
please.
worries. I just wanted to say thank you so much for adding the community space. This one I look forward to.
All right, any other questions for the petitioner? Hearing no other questions, do we have a motion to close the public hearing?
So moved.
All right, and a
Second.
second? All right, so with that, we'll start with Mr. Graham,
Yes.
Ms. Watlington,
Yes.
Ms. Johnson, Mayor Pro Tem, Ms. Ajmira, Mr. Mitchell,
Yes.
Mr. Eggleston,
Yes.
Mr. Driggs?
Are they serving pizza somewhere that I don't know about?
No, I know, I've only got 4 yeses so far. I'm looking for 2 more. Mr. Driggs, help me out here.
I'm
Mr.
a yes.
Driggs,
Yes.
Mr. Bakari.
Yes.
All right, is there anyone that objects to the closing of the public hearing? Hearing no one object, the motion passes unanimously. The next item is item number 38. Petition, I'm sorry, Madam Clerk, that's time out for
We're out of
everybody.
time.
We all
That's
need
right.
a
I'm
break,
sorry.
right? All right, we're close. Actually, it's only 7 o'clock, guys. We're doing well. We're really doing well. So let's start with item number 38, 2020-019 by Dependable Development, approximately 18 acres on the Plaza Road extension. It's in District 5. Current zoning is 3 units of housing per acre. Resident requested zoning is 8 units per acre of multifamily conditional. Staff recommends approval with resolution of technical revisions. And we have Mr. Schaefer, Mr. Said.
Good afternoon, everybody. I'm Dina DiOrio, Mecklenburg County Manager. I'm joined today by Deputy Chief Jeff Estes from CMPD, Dr. Raynard Washington, Deputy Health Director, Dr. David Calloway from Atrium Health, and Chief Robert Graham from Emergency Management. Our sign language interpreters today are Rick Hefner and Meg Tucker. And as is always the case, our press conference is available via closed caption for the hearing impaired. I want to thank all of you for being here today. Today we will announce the details of the new alcohol consumption and sales restrictions. We'll update you on our latest public health data and provide details on our public-private partnership to distribute 2 million masks to our community. Each of our partners will make comments, and then we will take your questions. I will start with the updated proclamation related to alcohol sales. Mecklenburg County, the City of Charlotte, and the towns of Davidson, Matthews, Mint Hill, and Pineville have signed a revised proclamation that requires restaurants and private clubs serving food and alcohol to close for on-site and beverage consumption between the hours of 11 p.m. and 5 a.m. Restaurants may continue to offer drive-through, delivery, and/or pickup services from the hours of 11 p.m. to 5 a.m. In addition, restaurants, breweries, wine shops, private clubs, bars, and any other businesses that are permitted to sell alcohol for on-site consumption are not permitted to sell alcohol for on-site consumption between the hours of 11 p.m. and 7 a.m. These restrictions do not apply to restaurants that do not serve alcohol. The restrictions will stay in place as long as Phase 2 of the governor's order remains in effect, which is currently August 7th. The towns of Cornelius and Huntersville are not participating. A violation of this proclamation may subject the violator to prosecution and is punishable as a Class 2 misdemeanor. This revised proclamation is designed to put a stop to the behaviors we have seen in recent weeks, where we have seen videos of establishments where patrons are not wearing masks and social distancing has been non-existent. It is unfortunate that we must take these steps due to the poor decisions by some bad actors. We hope that by taking this step, we can begin to slow the spread of COVID-19 in our community. I know that there are a lot of questions around how the proclamation will be enforced, and at this time, I will invite CMPD Deputy Chief Jeff Estes to discuss that. Thank you.
Thank you, Madam Manager. We, as with this proclamation and all of the others, we will take the first step of education, and we believe this is today the first step in ensuring that everyone knows exactly what the proclamation says. Having said that, as everyone already knows, alcohol is a highly regulated commodity here in North Carolina, as it is in most locations. We're fortunate that we have partnerships already with our alcohol enforcement officers at CMPD, along with the ABC Commission officers in Mecklenburg County, as well as North Carolina alcohol law enforcement agents. We already work comprehensively together, and we will do so to ensure the enforcement of this order or proclamation is enforced. We have good relationships with many, if not all, the alcohol serving businesses here in the county, in the affected areas of the county, and we will ensure that there is compliance there. Again, it is a lot cleaner for us knowing that at 11 o'clock there is no more alcohol sales at these different locations. So we'll do education first. We'll give you warning, give those folks time to comply, and we will remain vigilant for these type businesses to ensure that they're adhering to proper practices. And that goes up and through, up before 11 as well. So we're not just going to say, hey, at 11 o'clock we'll start strictly enforcing. Up until 11, if we see establishments who are not enforcing what is safe practices as far as having crowded bars and no masks, et cetera, we'll also educate them on that. Then when 11 o'clock hits, we know that service already stops. We already have alcohol limitations on when it can be sold here, and this is just moving the hours back so that we can kind of get a hold on the lack of social distancing and, quite frankly, in my opinion, irresponsible business operations by some businesses here in the county, so we can hopefully try to stem the tide of COVID-19. Madam Manager, thank you.
Thank you, Deputy Chief Estes. Next, we will have a public health update from Deputy Public Health Director, Dr. Raynard Washington, who is filling in for Gibby Harris while she takes a little bit of time off this week. Dr. Washington.
Thanks, Madam Manager. So good afternoon, everyone. Thanks for joining us. To date, we have had 17,782 confirmed cases of COVID-19 among Mecklenburg County residents. More than half of those individuals have met the CDC criteria to be released from isolation and are doing well, thankfully. Unfortunately, we have lost, as of a little while ago, 186 individual lives here in Mecklenburg County. Our thoughts and prayers are, of course, with those members and their families. In terms of our trends, our percent positive has remained fairly stable over the last few weeks, which is good news. It's been just around 11%. We would really like to see that number start to decline a bit, but we are excited that it's at least remaining stable and not accelerating. We continue to see a very slow increase in the number of people that we have in the hospital due to COVID-19 in the county. Our hospital capacity is currently stable and in what we call the green zone and is not surging. We are monitoring this very closely with our health systems just to ensure that we avoid any rapid acceleration and overwhelming. In terms of testing, there is a lot of testing happening in the county. We have expanded testing so much so in our county and really across the state and the nation that laboratories are starting to experience extended turnaround times. We are aware that some folks are having to wait a week or longer to get test results, and we are working very diligently with our state partners to try to address this. It's a real challenge for both the public health response as well as for individuals, of course, having to quarantine to wait that long for test results. So we are working really hard to address that. We had a meeting just yesterday with our hospital systems and our laboratories to try to work on opportunities to improve that turnaround time. New guidance from the CDC is helping us a little bit with this. It was just released last week that it's very clearly stating that individuals do not need to be retested to return to work or to school after they test positive. So it's really important that individual companies and businesses don't require individuals to be retested, because that certainly takes away from available tests for folks who may need them. And also in regard to testing, we are hosting another one of the mass testing events in partnership with Mako Medical next weekend. So it will be held on August the 1st and the 2nd. We will start at 7 a.m. this time instead of 9 a.m. and go until 1 p.m. Just to avoid the heat and to sort of take care of our staff. It will be held at the Valerie C. Woodard Building, which is located at 3205 Freedom Drive. There is no cost to be tested, but we do want individuals to bring their insurance cards and their IDs because federal regulations do require us to do so. If you don't have insurance or you don't have an ID, you will still be tested, but we have to request folks to do that. We will have a drive-through option as well as a walk-up option as we had the last time, and we are aiming to test at least 1,000 people each day. More details will be released later this week on how to sign up for testing in advance if you'd like to pre-register. And again, you will be able to get tested next weekend at Valerie Woodard. Even as we're managing the COVID-19 pandemic, we still have a lot of other public health issues that are really important and we have to continue to respond to. And one of those is immunizations for other infectious illnesses, particularly among our kids. So I just wanted to emphasize how incredibly important it is for families to get kids immunized on schedule, even with the school system's adjustments to their scheduling. As of now, children are still expected to be immunized on schedule with the start of the school year. And so it's really important that we have folks getting kids immunized. In order to accommodate physical distancing and managing crowds, we will not be having the large Big Shots events that we normally have. But instead, we're holding a series of weekend clinics for immunizations for children. The first of those will take place this Saturday at our Northwest Health Center located at 2845 Betty's Ford Road from 8 a.m. to 5 p.m. To, again, accommodate the crowd, we're going to ask individuals to sign up for appointment slots. We do have a number of them available, so please call us at 704-336-6500 to make an appointment. And we also have appointments available at the clinic Monday through Friday, also from 8 to 5 to get kids immunized. So please, we're imploring you to not wait to the last minute, and please go ahead and get your kids signed up to be immunized. Lastly, I just want to reemphasize the role that we all have to play in this response. Really is our public health staff are working really, really hard day in and day out along with our emergency management teams to really sort of manage the response in our health systems. But we really all have a role to play. And so I really want to just reinforce those basic things that everybody can do to help us in this response. That includes wearing a mask, ensuring that you're keeping your distance from folks, washing your hands and surfaces, and of course, please don't gather in large groups. That's one of the worst things you can do right now, either inside of a building or anywhere, is gathering in large groups. So thank you and look forward to your questions.
Thank you, Dr. Washington. As you know, Mecklenburg County and the Charlotte Executive Leadership Council, under the leadership of Atrium Health, are distributing 2 million masks to our community. Mecklenburg County donated 1 million masks to the effort, and Atrium Health is coordinating not only the donations from the CELC members, but also leading the distribution effort. Dr. Calloway from Atrium Health and Emergency Management Chief Robert Graham are going to provide an update on that effort.
Thank you, Madam Manager. Good afternoon, everybody. We are on day 184 of the Emergency Operations Center activation. This is the longest period of time that I'm aware of that the County Emergency Operations Center has been activated, and we will continue to be activated throughout this event. Charlotte Mecklenburg Emergency Management and our partners continue to respond to the COVID-19 pandemic while also monitoring and planning for other potential issues as they arise, including hot weather. As we are all aware, it's summer in Charlotte. We're used to that. However, we are expecting a heat index throughout the week to rise above 100, and certainly it will today and then through the weekend and early next week. We're also monitoring the election process, and it's very important. We had plans to do that before COVID, but it's even more important now as the election board has made decisions yesterday and will continue to make decisions related to the election and early voting locations. The tropics are heating up. So as we move into late July, August, September, as always, we're monitoring the tropics. We're currently monitoring 2 tropical systems out in the Atlantic. One became Tropical Storm Gonzalo today. And so I want to remind everybody that sheltering, emergency sheltering, is always a challenge, but it's even more so during a COVID environment. So we encourage all our citizens to develop a plan of where you would go should you need to leave your home due to an emergency. So have a plan, know the plan, and make sure that you're ready to move when called upon. Emergency shelter should only be used as a last resort. For emergency alerts via text, phone call, and email, sign up for charlemeckalerts.org. We encourage everybody to do that, and I do it. When bad weather comes in, you will automatically receive warnings for the area that you're in. EOC activities include working with the policy group made up of our leadership from Mecklenburg County, the City of Charlotte, all towns within Mecklenburg County, public health, law enforcement, medic, the healthcare systems, and CMS to continue to make coordinated decisions, but also to gather information and make those decisions for our senior elected officials to ultimately make and put into proclamations as we go through this event. Monitoring the status of personal protective equipment, PPE, supporting the community through a variety of ways, including through our volunteer organizations active in disasters. To date, we have distributed 3,654,572 meals in the county. And that is a good illustration of the kind of data that we collect at the Emergency Operations Center for our policy group and our senior elected officials. We continue to support Mecklenburg County Public Health and Gibby Harris and her staff as they work through this event. Gibby is the point, but we bring in the organization to support her, the county, and the towns and the city as they move through this. We're also, as the Madam Manager discussed, a coordinated mask distribution. The Million Mask Initiative is a collaborative effort across many public and private partners, including Charlotte Responds, Mecklenburg County, Atrium Health, Charlotte Mecklenburg Emergency Management, the Charlotte Fire Department, which emergency management falls under, and our community partners. These partners have worked together over the past month to create a comprehensive mass distribution plan to ensure that masks are provided to our community's vulnerable and at-risk populations. My good friend Dave Calloway will discuss Atrium's part in that, and he has joined us today. I'll now turn it back over to Dina DiOrio, our wonderful county manager. Or I'm sorry, Dr. Calloway, I'm going to turn it over to you.
Thanks, Chief Graham. Glad to be a friend of the fire chief. Thanks, County Manager DiOrio. My name is David Calloway. I'm an ER doc in town and helping to coordinate this Million Mask Initiative. Atrium Health is proud to be a healthcare leader in the space and working with the county and our private sector to get masks out to our community. This has been an incredibly successful public-private partnership with the Charlotte Executive Leadership Council and the great leadership of the Mecklenburg County team led with Atrium Health to bring together the different assets that we have across our community. What started as a Million Mask Initiative, as County Manager DiOrio and Chief Graham mentioned, has now become over 2 million masks that are being donated and distributed to at-risk populations across the Charlotte region. I'm happy to say that in just 3 weeks, this coalition has already distributed over 500,000 masks to our most vulnerable population in Charlotte, utilizing our partnerships and our community outreach in the different organizations working with the Hispanic, the African American, and the elderly populations. It has been so successful. Our CEO and president from Atrium Health, Gene Woods, testified yesterday in front of the U.S. Senate about the important role that this type of public-private partnership plays in getting our schools and our economies and our communities back online. Our message has been clear from the beginning on the medical side. Masks save lives. They decrease the spread of the coronavirus. Last week, Dr. Redfield from the CDC, the director of the CDC, was in town, and he told our community that if 95% of the community wore masks, we would beat coronavirus in 28 days. If we all wore masks, we would beat coronavirus in 28 days. Our messaging from the social and personal responsibility side is the same as well. My mask protects you, and your mask protects me. It is our responsibility as citizens of this community to wear masks and to look out for each other. This could not succeed without the tremendous foresight and leadership from the county, the willingness of our private sector to step up and help with private donations, and the leadership from Atrium Health and the other healthcare community members to get these masks out to people, get them on people's faces, and to make sure that we are wearing masks as we move forward. So, County Manager, thank you for the time. I appreciate it, and we're happy to take questions moving forward.
So we can start taking your questions at this time.
Hey, Dan. My question is for Deputy Chief Estes.
Afternoon.
Hey, Chief. If an officer catches you going 80 miles an hour down Tryon Street without a seatbelt, you're not going to get education and a warning. You're going to get a citation. So how much education and warnings do these places need? Why not just put your foot down? The order is cut and dry.
You broke up a little bit. I heard something about a seatbelt and something about cut and dry.
Yeah, the order is pretty cut and dry. Why issue education and warnings here? Why not just put your foot down and enforce this thing?
Yeah, well, here's what I've learned. Even laws that have been in place and established for a long, long time, there still can be confusion around exactly how we apply these orders. These orders are brand new. In fact, I don't think they're technically in effect yet. So a business may have a practice that they believe is in place. In our country, intent means everything. So we wouldn't want to unnecessarily cite at first glance a business who legitimately believed they were doing the right thing. And I can tell you this, we're really pretty good at figuring out a lot of times what the intent of the business is. So if we go to a place, we tell them you're operating outside the bounds, we wait. They don't comply, after a short time period, then we have no problem in citing at all. Like I said, a lot of this will be shortcutted just because the alcohol is already highly regulated. They already have cutoff times, and so this is just shortening that up just a little bit. So businesses who we already know are in violation, we'll be taking a very close look at them off the bat. And others, when I say a warning, that means we get a violation or we stop by and we see a violation, will remain on site until they comply.
This is Brett Jensen. Sorry, this is Brett Jensen with WBT. This is for Dina. Hey, Dina, I'm curious. Can you talk to us about the conversations you had with Huntersville and Cornelius and why they decided not to join the rest of the county?
So first, I will answer your question. I just want to make it clear that the order will be posted on our website tomorrow, which is when it becomes effective. I've neglected to put that in my talking point, so I want to make sure that that's clear. The effective date will be tomorrow, July 23rd. So back to your question, what they did was that they looked and had conversations with their police departments around whether or not they saw the kind of activity that we were seeing here in Charlotte, and whether or not they had any concerns about that happening in their jurisdictions. And after reviewing what was going on in their towns, they made the determination that they didn't have a problem that needed to be solved, and for that reason, they decided to opt out.
Dina, hey, it's Eric Spanberg with the Business Journal. I'm just curious, you have the business roundtable, and you're obviously hearing from people in the business community all the time. How much pushback did you get from restaurants or others in the business community who are already struggling because of the restrictions in place in the pandemic?
So really, we didn't get a lot of pushback. We got a few emails from folks, but I will tell you that it was feedback from the restaurant industry, which sort of helped us make the decision to go from 10 p.m. to 11 p.m. The feedback that we got is that there's a lot of people who like to dine late. They'd like a 9 to 9:30 dinner reservation, and so by pushing it to 11, it allowed restaurants to accommodate them and have less of an impact on their business. So that was really I think the most significant feedback that we got, and we were able to accommodate them.
Hi, Dina. This is Robin with Fox 46. Wondering if you guys have found that some businesses are trying to, since bars are still not allowed to be open, if you've found that some businesses are trying to skirt around that and become a restaurant just to be able to stay open.
I don't know, Dr. Washington, can you respond to that? Because that's a permitting issue.
Yeah, so we're not actually aware of businesses working to actively get a new permit or license for the sake of becoming a restaurant, but we are aware of some who already had a license to serve food or were certified to serve food, wherein the environment they're not really complying with social distancing on the inside and may or may not be selling large amounts of food at like night hours. And mostly selling alcohol and other types of drinks. And so those are certainly a concern and part of the reason why we are putting together this order.
This is Courtney Davis with Spectrum News. I was just wondering, is there anything that the county is doing to try to help some of those private bars that have been closed since March 16th that haven't been able to do any alcohol sales at all right now?
So we have a small business loan program that we put in place really early on, and we, folks that qualify for that should certainly take advantage of that. I know that the City of Charlotte has launched a small business grant program, and so businesses can take advantage of that. But we don't have any specific program for bars that have not been able to operate.
Hey, this is Katie Peralta with the Charlotte Agenda with a question for either Dina or Chief Jeff Estes. I had a question about enforcement. Now, I know that, this is going to take businesses know what's going on.
Katie, you're breaking up. Can you repeat the question, please?
Sorry, I'll start over here. I know that this order is going to require some education on the part of CMPD with local businesses to kind of explain what's going on. Why has there been more enforcement of COVID-related restrictions on businesses? I mean, this isn't the only thing that they're violating. I mean, we've seen large gatherings late at night and during the day. It's not like this is anything new.
Well, some of that I didn't hear, but it sounds like to me that the gist of the question is that, why we think, why we haven't done more enforcement in the past.
Yes.
Yeah. So what we have tried to do and to be candid with you, where we could enforce and we didn't get voluntary compliance, we did. Now, I think it doesn't take but a quick reading of the governor's orders that we're in to see that there are many, many exceptions and many holes that folks who don't want to comply with the spirit of the law can usurp what the spirit of that order is. It becomes very difficult to enforce the letter of the law, people's own personal and behaviors. So, for example, if the large gatherings thing, there are many exceptions to that. I can give you an example where we have a lot of calls about a lot of people at private residences, and we would go over and over again. It would turn out it would be a wake, or it'd be some religious service, or it'd be some. So things aren't always as they seem. But where we could enforce, we did. This one, a little bit different. It's aimed specifically at businesses who serve alcohol. And so since we already have a unit in place and multiple agencies that enforce this, we believe this will be one that we can enforce the spirit of it with compliance. And if we don't, then again, as I said, we'll enforce up the chain, as it were, to levels of enforcement. So based on what we had, which is a new public pandemic, new laws, new ordinances, and having to alter people's ways of life with variances and allowances for people who could opt out, as it were, based on different circumstances. We have done the best we could up to this point, and we believe we'll continue to do so moving forward.
This is Hannah Smoot with a question for Dina. Dina, I'm looking at a draft of the proclamation that includes a clause prohibiting restaurants from allowing patrons to touch shared surfaces such as bar counters or game equipment. Is that going to be included in the order posted tomorrow?
Yes.
Yeah. Okay, and the prohibition on gatherings of more than 25 people, does that go further than the statewide outdoor prohibition of 25 people or more in gatherings?
No, that's consistent with the state's order around outside gatherings.
Hey, this is Paige Peroso with WBTV. Can you talk about the thought process of closing the bar counters as well? Many restaurants are using that space and socially distancing as tables after they already are doing just 50% capacity. Why close those bar counters as well?
Well, we had conversations with our public health team, and they really believe that, bars, because you can't really effectively socially distance, that it really made it hard for people to be able to eat there effectively and safely. And so after having that conversation, we made the determination that we wanted to exclude that as part of this order as well.
Hey, it's Allison Kuznets from the Charlotte Observer. I have a question for Dr. Washington.
Yes, ma'am.
As far as, so we're seeing about 6,000 new cases already this month, and if we're on track for about 8,500 cases, how many of those cases would you say can be traced back to these restaurants and bars, these venues that will be impacted by this proclamation? And what are some behaviors you're seeing? What's driving the growth in cases and among younger residents in the ages of 20 to 59 right now? What behaviors, what settings can you trace the cases to?
Yeah, so as you've heard us talk before, we make an attempt to reach out to every individual who's diagnosed with COVID and try to understand where they potentially were exposed to COVID and who they may have exposed while they were infectious. And so we, at this time, I don't have a strong estimate of how many of our new cases are related to people participating in gatherings of these types or in spaces that aren't well socially distanced, but we are working to investigate those very well. I think the simple message is we know that wearing a mask works. We know that keeping distance works. And we really just need everybody to comply and to take on personal responsibility in that so that we don't have to do things like this in terms of passing these types of regulations. The idea is that individuals know that we shouldn't be gathering right now. They know we shouldn't be in close contact with each other. This isn't the time to be having large socialization events. And we have to do this because we have a lot of big things we need to do. We want to get all of our businesses open. We want to get our kids back in school, and we need to be able to do those things. And to do that, we have to get everybody complying with just simply wearing a mask and keeping your distance from folks. And of course, if a place is crowded, go somewhere else. And obviously, we need the businesses to help us do that as well. So, thank you.
Hi there, this is Vanessa Rufus with WCNC Charlotte.
Unfortunately, you're breaking up.
Information on the state. Hello, can you hear me?
I can hear you now, yes.
Okay, this is Vanessa Rufus with WCNC Charlotte with a question about hospitalizations. So at the beginning of the week, we started to get the state dashboard information that kind of broke down hospitalizations by region. And I'm seeing as of this morning, the Charlotte area, which includes Mecklenburg and some other surrounding counties, ICU occupancy is close to 90% and inpatient occupancy is around 84%. Do you have any figures Mecklenburg specific as far as ICU and inpatient occupancy? And then my second question is, yesterday we heard Dr. Cohen of the HHS talking about the concerns with Charlotte's proximity to the South Carolina state line and how basically hospitals, they're getting some reports of people crossing state lines from South Carolina coming into the Charlotte area to get treatment as well as testing. Are you able to speak on that?
Yeah, so I'll take the first question. So we do in our biweekly releases report the number of people that we have in the hospitals due to COVID in Mecklenburg hospitals. We are aware that our hospitals are running at around 80 to 85% capacity in terms of total beds. And I believe that the ICU estimates are fairly similar as well, around 85 to 90%. So that is consistent. And again, we are monitoring that on a daily basis. I'm just not remembering exactly how many beds were full this morning. And then we are working very closely with them to be able to look at how quickly that growth is happening and to monitor that very closely. In terms of sort of folks seeking care in Mecklenburg from surrounding areas, we are aware of individual hospitals, not just in the South Carolina area, but also in some of our neighboring counties that have lower capacity than some of the acute care facilities here in Mecklenburg County. And we know as they either go on to diversion or are no longer accepting new patients for periods of time, that does impact the hospitalizations here in Mecklenburg County. So again, we are keeping a close track on that. We do monitor hospital capacity for the entire hospital, so that the number of people we have in the hospital doesn't just include Mecklenburg County residents. So we are looking very closely at how many people are coming, and so we know some of that's happening, but I can't speak to the exact magnitude of it.
This is Brett Jensen again with WBT News. Dr. Redfield was mentioned earlier about wearing a mask, and this thing could be pretty much killed in 28 days if everyone did it. But he also mentioned and said how it's far more dangerous to keep kids at home rather than putting them at school. And even one of the atrium infectious disease doctors from in charge of pediatrics said last week that there really is no data to support that kids give it to adults. It's always pretty much adults giving it to kids. With all that being said, do you think that kids should be in school?
Yeah, so I strongly believe that we have to do everything we have to do to get kids back in school. I think the research is clear that kids learn best when they're in-person instruction. There are a number of other sort of health-related issues that are benefits of kids being in school. So I believe wholeheartedly that we need to get kids back in school as soon as possible.
This is Courtney.
A question on the hospitalization numbers. This is Hannah Smoot with the Charlotte Observer again. Just wanted to ask, we've had a couple of readers ask us what those hospitalization numbers really mean. Can you speak a little bit on that? Are those numbers people who are coming into the hospital with COVID symptoms, or does that include people who are in the hospital for, outpatient surgeries and test positive for COVID? Or how common is that?
Yeah, so those numbers actually only include people who are in the hospital for COVID-19. So there are individuals who go into the hospital, for example, for surgical procedures, like a hernia repair, and they may get tested and they test positive. Usually those individuals are not admitted to the hospital, they're usually sent home once they test positive. So those really are a good reflection of patients who are actually in the hospital for COVID-related complications. It doesn't mean COVID's their only problem, but that's why they're there.
This is Robin. News. I have a quick question for you guys. With the ban on alcohol sales again, were there any restaurants?
Sorry, you cut out.
Can you hear me again?
Yeah, I can hear you now.
Were there any restaurants that had been cited for not having their patrons social distancing or wearing masks properly? And was that anything that was looking at for the enforcement side of things before this ban went into place?
Yeah, I'm going to turn it over to Chief Estes for that.
The short answer to your question is, without the specific prohibition, we hadn't had any enforcement efforts around social distancing in businesses. We are, again, we are much more confident with this this current proclamation that we will be much better footing to be able to enforce. The ones we did see, we would get, you know, on Monday morning from a Friday night or a Saturday deal, and then we would go speak to the businesses, and they would say that they would be in compliance. Anecdotally, what we've seen is the later the night went on, particularly with alcohol serving establishments, that the social distancing that they had earlier, the patrons would get closer and closer and closer, and as the alcohol flowed, the social distancing sort of kind of went out the window, and quite frankly, it become very difficult for the businesses themselves to enforce a 6-foot deal and all that. So again, that's why we hope that by doing it this way, we'll get better regulatory compliance.
This is Robin, again with Fox 46. This is for Deputy Chief Estes. You mentioned that a little bit about what you guys are doing leading and
I'm sorry, I missed all that. I'm sorry. Perhaps can you get closer to your microphone? We didn't hear any of that.
Estes, can you hear me?
Yes, I got you.
This is Robin with Fox 46. You mentioned earlier that you guys are looking at what you're looking at enforcement leading up to 11 p.m. and last call. I was wondering what specifically you're going to be doing to prevent crowding at, say, 10:30 right before last call.
Yeah, just as the larger establishments, just reminding them of what happens at 11 if we can, to try to keep social distancing to a maximum, if you will. And so what we just didn't want to say is that we'd wait till 11 and then try to go in a place we would try as early as we could to make sure that businesses knew what were required of them and that they would be in compliance. We do feel confident that most all businesses will comply and that we won't have a large amount of businesses who are just objectively not complying with the proclamation, because I think everyone knows that the alcohol sales and alcohol permitting is a very, very important part of their business. And so we're hoping that they can operate as efficiently, as effectively as they can, be able to make their profits all the way up with alcohol all the way up to 11, and then afterwards do their food service or whatever they need.
This is Brett Jensen again with WBT. This is for Dr. Washington. Dr. Washington, can you confirm what many doctors and executives at the hospitals have told me about the percentages that even when there isn't a pandemic, they will run normally anywhere from 70 to even 85% full just on a normal year, on a normal month, on a normal day? Can you confirm that?
Yeah, and even sometimes as close to 90 to 95%. I mean, that's pretty common for hospitals to run very close to capacity. What we don't account for in those numbers is their surge capacity, which is their ability to extend their capacity beyond their usual or routine capacity. And in preparation for the pandemic, we certainly have, both of our health systems have extended their capacity even above and beyond sort of their usual operating capacities.
Okay, we can take one more question, please.
Courtney Davis with Spectrum News. I was just wondering how you guys are doing with contact tracing and the number of people that you have working as contact tracers. Has that been going well? Do you guys need more people to volunteer to do that as well?
Yeah, great question. So our contact tracing is going well. Of course, it is difficult in the environment where we have delays with test results. It does create a challenge, some challenges for us, but we're working through those as best possible. So contact tracing is going well. We have well over 100 individuals doing contact tracing routinely in the county. We are hiring additional contact tracers now, some on a temporary status or temporary basis. So if people are interested, there are a number of job postings for some additional supports that we're currently hiring for, just in anticipation of needing more support.
Thank you, everybody. Appreciate your time today.
Thanks.
Stand by.